Uh-oh, he froze up. Is that you? Can you hear me, Alex?
Yes, I can hear you.
Okay, that's Chicago's frozen.
Honey's
Um,
frozen.
well, no, no, I wanna go reach back to you and say you're absolutely correct, and we know these things. And so one of the things, and I know I'm always trying to be the peacemaker in some ways, but it's just all about trying to bring all these resources and keep everybody accountable. So one of the things that we're working on, I'm new into this position, but the executive director, Brandy Grant, and I have had several conversations now with um, Dr. Hofgott for this very purpose to get this feedback right here. And it's not like it's the first time we've had the conversation. I understand, but hopefully in this position now that there's a louder voice, that we can sit down at the beginning, like you said, before the questions are formed, to be more inclusive. Um, and I get what you're saying, Alexander. I'll talk to you later offline, but I understand where you're coming from. But um, it is just a frustrating feeling to not see something on this list that, like, dog poop in my garbage can. Now I'm
Okay.
just joking, but
No,
And apologies
that's
on that,
serious.
Alex. I lost my connection, but I most certainly can make a connection. Felicia has my email. If you could, email my Hotmail, then I would most certainly can connect you with the folks at Parks if you want to learn more about how we did that. But just to reiterate, it was like we had definitely a four-prong approach: the standard online, the the town hall forum kind of online where there was people could just kind of log on. Then we had in person with leadership going to different community meetings that we had on in person. And then we had our ambassadors, like Miss Winona talked about, that showed up at different places where we knew people were going to be, and we would have them work the survey. And the
thank
last part that I would say, maybe 4.5, is that we also had people that worked in certain areas add questions to the survey for their particular list. So, for example, I work in environmental education, and so we most certainly had all of the standard questions that we were asking, but then they asked me to ask for when I sent out the list to my list, I would add two or three questions that were pertinent to my work. So, and that's what kind of got everybody to buy in because, okay, wow, you're going to be able to get this data back and you're not just kind of collecting data for other people. Like this is going to help your program too, right? And that's what got individual staff in the mood to kind of send out stuff to their network. Because traditionally, people don't like to send out other folks' stuff, right? So you had to kind of have that buy-in, um,
you.
and that's how we did that.
Shikani, thank you so much for being here too. I appreciate your presence.
Yeah, well, it's
Um,
that extra email. You sent that extra email out, and that was
Man,
a reminder. So good job.
I
Yeah,
was scrambling.
I think that extra email kind of triggered me too,
Okay,
actually.
okay,
But
okay.
but I want to just say one more thing,
Mhm.
Alexander, just to respond to you responding to me, and thank Chakundi for giving us more information on it. I wasn't imagining things that came out of the Seattle Parks Department, and it was real. I like when he said the fourth part of it, and that was the ambassadors. It's like, who
Mhm.
are you sending into the community? Just I'm just not bragging, but this is fact. I just had my 50th Garfield High School reunion, and we had our mayor elect, Bruce Harrell. We figured it out before that he was probably going to be the mayor, but we invited him to come, and he opened up at the Central Area Senior Center, where I am on the board. Now, this is important because when, the face of policing, when he came in, there were and he's mayor elect, he's not the mayor yet, right? But when he came in his presence, it was him, I'm in an organization with his wife, Joanne, First Lady elect Joanne, her a gentleman who I assume with security of some kind, African American
Hmm.
guy, and then another sister, she had on a trench coat, and then there was some other. Now it wasn't until the end of the time when he was talking about welcoming us, being glad we're there, and then he said, the face of policing and the face of community is going to change. And and then he pointed out that the sister with the trench coat was in fact a police officer. Now
Hmm.
we didn't see that. She had on fancy boots and a trench coat. Now who would know she's packing? But the point is that we've got to do some things to make people less um, feeling less uncomfortable
Yeah.
uh, for the presence of police and policing in this community. We've
Well,
got to
we got a lot of work to do, and I'm so glad you're on the call because you'll be back.
have. Okay,
I know how to
but
find you now.
yeah, you find me. You'll find me for sure. But I'm just saying, your team take that suggestion about the ambassadors. What about some of these young people who've had like some minor infractions or whatever? Get the people engaged. Get them paid to go out and take these surveys. Get people. You have a team leader that works with them. Use some of the agencies like Hazel Cameron's agency, Seattle Mentoring,
Yeah.
CARES.
I,
Other agencies. Let's get the people out there getting the information.
Thank you, Lona, because we got about 20 minutes left. But I definitely want to have another conversation with you because, these are the things that we can get going now. Okay, I had Angela's hand up first, and then Cindy, and then Dr. Gail, and then
Okay,
Brent.
with
20
all
minutes
of the
left.
things that everybody's been chiming in and talking about as
Hmm.
far as being able to bring in more of a equitable inclusion of gathering information so that we can be transformative in what is being accomplished. One of my question is, for that to be at Seattle University and they do have a Black Student Union, why aren't some of the students from Seattle U's whose discipline mirrors the information that you're trying to gather, why aren't they a part of this process?
I want to make sure I'm understanding your
My
question.
question, okay, so my point is, when you mentioned that diversity was an issue for the compiling of this process, I'm saying that there's a Black Student Union at Seattle University. And so, in the beginning stages of forming this, or whatever the next steps are in considering transforming this process, why aren't students whose disciplinary education track are not included in this process at school?
Um,
So if someone is going into criminal justice, if someone is doing law enforcement, if someone is doing scientific analysis, that's part of the Black Student Union, part of Seattle University, who is working with the police department. I'm just saying, if we want to have a balanced lens of how data is being created, how data is being formed, so that you can decide how to make intelligent decisions, and others on this call have brought up other brilliant ideas and suggestions. I'm just saying that that should be some other area to consider
Yeah, that's
to
a good
include.
idea.
it is.
It's a very
It is an area that we consider, and every year, when um, we get ready to gear up for the survey, we message student groups asking for volunteers to help distribute the survey, because we don't have we do not have a large budget to pay people to go out. So the people that go out into the communities to do this survey are really, it's me, it's my three other research analysts. We're and any volunteers that we get to go out and distribute the survey flyers, we're it. And that is a big hurdle that we attempt to overcome. Our funding isn't through the university; it comes from the department. Um,
um,
and so that is something, a hurdle that we that we have to overcome, but it's something that is not necessarily something that we can do ourselves. We've been renewed every year since the implementation of this project, which is back in 2015. But as part of, and as for why, I can't say, because I don't know, but we didn't get as much money this year. So going forward next year, we like to have one RA in each precinct and one general RA to help out. We currently have, and that would be 6 RAs plus our 2 researchers. We have 4 RAs right now. I'm managing 2 different precincts at the moment. And moving forward, because of the funding that we've been provided for next year, we're probably going to have we're only going to have 3. So we need to rely more on volunteers and much kind of like what Shikundi said about people adding that personal touch and that buy-in. We encourage, and he even said like to encourage people to email people that they know, their friends and family. We say the same thing in our emails out to people. Now it is not the same because it comes from us. It doesn't come from somebody they already know. So there is that hurdle as well. We try as best we can.
Thank you.
Right. Thank
Cindy?
you. Yeah.
Hi. Hey, I was just wondering, so I know, you said you were putting out community meetings and flyers, the surveys, are they translated into different languages when you're doing this outreach?
Yeah, so we have surveys in 11 different languages that are translated. Let me see if I can go back to that slide real quick.
And then do you also have interpreters at the town hall meetings? You said you did focus to expense.
So unfortunately, we do not have interpreters, but what we do have, so we have these flyers that you see up on the screen right now. And when people scan that QR code, or when we discuss with an organization that wants paper surveys to help, we find out what languages they would like that survey in. And the 11 languages that we do have the survey translated into are up on the screen right now. And so we try to be as inclusive as we can, given the restraints that we do have.
I had one more question.
Yeah,
You have under, I believe it's criminal activity, if you bring back the screen you had before this, you have youth intimidation, and then you also have criminal, under public order crime, youth intimidation, or criminal activity.
Mm-hmm.
When you say youth intimidation, you are talking about youth being gathered and together, or what does that mean?
So the questions are written in kind of as general a way as possible to capture as many different individual interpretations as possible. So we try not to, we say like youth intimidation or criminal activity, and we try, and I don't know specifically which questions in the survey off the top of my head would add to that particular tally. But we basically allow people, or try to allow people, to answer the questions based on their own interpretation of what is on the screen, if that makes sense.
I feel like when you have youth intimidation or criminal activity, you're automatically, if that's the answer, if that's one of the options that I have, you're automatically putting youth activity into criminal activity. Like it equals the same in the way that I'm reading that. So I'm just wondering if that's how you guys put it in the survey when you guys gave them the options of what answers they can have. Because I'm looking at other things in here, right? And I'm seeing things like there were other options, and they were like I believe like a property damage and graffiti, vandalism, right? Mm-hmm. But you have those, to me, those correlate more in youth and criminal activity. I guess okay. You know what I mean? Like whether you guys are intentionally or not intentionally doing it, you're just correlating
Okay, I'm
Barely hear you.
We're
yeah,
not reading it,
I was
so that's
having
why I was
trouble hearing you.
clarification. Oh,
Um,
I said it's correlating youth, youth, youth and criminal activity together. The way I'm reading,
Oh, oh,
I wanted some clarification on that.
okay, so I want to make sure that I'm understanding what you're saying. So, with the youth intimidation or criminal activity bit here on the screen, um, based on that, you feel as though that we are correlating any sort of youth activity with criminal activity. Is that, am I understanding your concern correctly?
With without knowing what it like, that's why I was asking, what does that mean when you have that on there?
Okay.
Because when I'm reading it, that's what it looks like. And I do apologize. I did come in late into the meeting, so I don't know if you explained that earlier.
I mean, off the top of my head, I cannot think of which questions in the survey relate specifically to uh, that concern. So I don't feel like I would be able to answer your question adequately, and I apologize for that.
That's
okay.
okay. Thank you.
Thank you,
I
Cindy.
appreciate it.
Dr. Gill.
Uh, Hi, Felicia.
Hi.
Yeah, I'm not sure how coherent I can be. I just tuned in at 7:19. I waited for 1 hour and 20 minutes on an incorrect link that is still posted on the CPC website.
Yeah,
I'm not
let
even
me, can
gonna,
I just tell you really quickly?
yeah,
I truly apologize to everybody about that. I don't know what happened with the Zoom link. I'm not gonna go all into that, but our communications person, last day was yesterday. So we've all been scrambling with trying to get you know, the pieces that he would have easily flowed for us. No excuse. I'm just
okay.
saying.
Okay.
So
I
please
just,
please forgive.
there's a lot of people not here, and I'm
Right.
really upset, but I'm going to try to be coherent. Um, this study is really offensive. And let me just point out here's what it says in the study overview. It's about the engagement. This is a quote: the engagement that recognizes the importance of resident perceptions in conjunction with micro community level crime data. I want to read that again. Resident perceptions. This is exactly what the CPC mandate is not, and this is exactly what we should not be doing. So I would analogize this to if Children's Hospital, in the middle of their mold scandal, decided to go into the community and ask the community what their perceptions of Children's Hospital is. That would be a very different reality than the people that actually suffered harm from being patients at the hospital. The same thing with a bias that's been shown with Children's Hospital. The community perceptions are not what the actual users are. So any survey that's being done, any engagement that's brokered or discussed by the CPC should really focus on the people who are the subjects, not the people who have perceptions. And I think this has been spoken of earlier today, but again, I didn't
Yeah.
get on until 7:19. But here's what's really important. I've been working in social science research and in science research for 49 years. Um, you have a non-random sample, which is a very serious problem, and then an underrepresentation of people of color, especially African Americans and Black people in Seattle and the greater area. It's underestimated by a factor of about 2 or more. And yet the way that you deal with that is a way that's been considered in science non-acceptable for over 40 years, which is simply to weight the data instead of using imputation statistics. And I can go all through that. I'm actually a person who in the 80s helped develop a lot of those methods. There are very acceptable, very respected methods that have been around for over 40 years. But instead you weight the underrepresented people of color. The problem with that is if there's bias, which there is, people have spoken to that. If there's bias in the sample, because it's using next door, it's using the SPD demographic councils. If there's bias, what you've just done by weighting the sample, a non-random sample, is you've actually magnified the bias. And that's what this is. And a couple of other things I want to point out. The people that are running this study, what do they say? Again, I'm reading from the actual research reports. They say many of the student research analysts have gone on into careers in sworn and civilian law enforcement roles and to work as research analysts in other areas of criminal justice, private security, and global risk management. And what they point to in those studies is people who've gone on to work for the Seattle Police Department, the Renton Police Department, the FBI, the CIA, et cetera. This is horrifying. I mean, there's a built-in bias at so many levels in this investigation. It's not, I can't even call this research. There's built-in bias. What people need to know is what are the users, just like my example at Children's Hospital. We need to know what are the experience that are people that are going to the hospital. We don't need the fluff and the PR around what what people think the SBD should do. And I want to end with one more example, very clear example, very concrete example. I live in Lower Queen Anne. In the early 2010s, we had a drug dealer in my building. We actually monitored that person. We took pictures. We developed a whole routine, me and the manager of my building. We sent that to the police department. The police department failed for 2 years to take action on that. For 2 solid years, did nothing. On one random day, we happened to have a police officer outside my building taking a break, eating lunch. My building manager talked to that person. Within 2 hours, there was a raid on that person's apartment, and they secured over $1 million in illicit drugs. And the problem is the person that was selling the drugs was creating havoc in my building and surrounding buildings because people that were coming to buy those drugs were also breaking into apartments and stealing packages. My point here is this. If you asked my perception would be based on reality, that the police did nothing. If you asked my neighbor's perception, who wasn't involved in this actual criminal activity and didn't reach out to the police, my neighbor's perception might be, we don't have good prosecutors. We're letting people get away with crime. Why are there so many homeless people in my neighborhood? This is a very specific and concrete example about how surveys like this really just absolutely misrepresent things. And again, the CPC should be getting back to its mission. Its mission is to deal with people that have been the victims of policing and not people who want to victimize, which is what this survey is. This is about people who want to victimize people because of the inadequacies in their lives and the problems that they see in their neighborhoods.
Thank you, Dr. Gill. And you make a very valid point, but please, at some point, the people who don't know about these surveys that are going on out there, unbeknownst to some, then that's the point. What CPC is about is to bring awareness to the communities about things that are going on out there that affects everybody. I'm going to go with Brent, and then I see Reverend. Yes, go ahead.
Felicia, you need to pause a moment because Dr. Gale wrapped it up. He totally captured everything that I think you've heard about why this study should not.
And all the points are very valid. I only got a couple of minutes. I don't mean to cut you off, but all the points tonight have been very valid. But I just want you guys to understand that that's the reason why that they've been invited and brought to the forefront, so that all this information and all these suggestions can be heard, validated and addressed. That's it. It's not to say, oh no, this is all perfect and right. It's for our community at large to understand what's happening that we are not engaged in, so that we can engage.
And then the most important thing here is that it will show why some communities are under police, Mr. Gale. I mean, really and truly, that was why some of the communities in Seattle is under policed. And as crime escalates, I mean, you'll see the bias, and you can see why. And maybe since you don't see that through African American eyes, we're looking for where the bias is at and how it relates to police response to the community, because there are people out there who actually are still waiting, who needs police services that they're not getting. Also, I mean, we got 81 mothers who are crying because their kids were, because, and you don't speak to that piece, Mr. Gale, at all.
Yeah.
And so,
Well, you know,
but anyway, that's it. I just wanted to see, to make sure that we understand that this will lead to
yes.
that plan, but how does that plan affects the central area and the south end?
Right. And you know, Dr. Gale's example about the drug person in Queen Anne, it was seen through very different eyes. And so, you know, that's a perfect example. Brent, I don't want to we only got a couple of minutes, but you've been patiently waiting. So please go right ahead.
Yeah, thank you. I do agree with Howard that you don't get a truly representative cross section of the community. I participated in one of these forums last summer, and I could see from the Zoom session that it wasn't a very diverse turnout. But not only that, there were more police participating than there were public. And this was problematic for me because it changes the whole dynamic of what the public is willing to say, or what people will feel like they can be candid about things, especially when it comes to law enforcement and crime. I would also say there were at least 3 officers who brought up the topic of city elections during that forum and were dropping hints for people to vote in a different city council, which I thought was really inappropriate. But there didn't seem to be a moderator that came in to say, oh, well, this is kind of out of bounds of, you know, what we're here to discuss. It was just kind of allowed to go on, but I thought that was quite inappropriate. I would also say that whoever does these surveys in the future, there are some real questions about what the institution that's doing the survey, what their relationship is with the city of Seattle and with the criminal justice system as it is now. I think it's important for the public to understand how the whole thing was set up. So thank you.
Thank you. Let's
Can we
see.
speak to that? Okay.
It's 8 o'clock. I want to thank everybody. I was trying to put my contact information, but anybody that worked in the city knows it's Felicia.cross at seattle.gov. Couple of things. One is I don't have people's email addresses. So I'm posting it on the website. Using the address lists that I had from, you know, other community endeavors. So if you want me to send you the notices, I tried to get it out there as best I could tonight under the circumstances. Please email me and let me know that you want to be on my email list. Um, and then the last thing I wanted to say, Dr. Helfgott, she did offer she wanted to be here tonight, but she had another event that was already booked, but we can have her come back at another time if that is of interest and it sounds like it is. So if you guys would like to have her back, we can schedule that. Alex, thank you. You were a trooper. I appreciate you for being here. Let's see. Does anybody have any quick updates or information that they want to put out to the community?
Real quick to say that up on the screen right now is Dr. Helfgott and Dr. Parkin. Their email addresses are there, and a good phone number. Please bring concerns to them. I am merely somebody that goes and distributes the survey, looks at the data afterward, and writes up a report. These 2 individuals on the screen are the ones that design it, that do the statistical analysis. So for concerns like what you had, Dr. Gale and Brent, and Harriet and Cindy and Angela and Winona and everybody who has concerns, these are the 2 individuals that you're going to want to contact to bring those straight to the forefront.
Okay, thank you.
Great,
So,
thank you.
so,
I appreciate that. And
oh,
then
okay.
also, you asked for announcements. I
Yes.
just wanted to make sure that people know that we will continue to offer free boosters and vaccinations December 7th at First AME, First African Methodist Church, in partnership with Central Area Senior Center and Mount Zion Baptist Church. So if people are still in need, or people within the community that are in need of boosters, we urge you to have them contact Mount Zion Baptist Church or directly to the Central Area Senior Center.
Okay. And thank you for sending the flyers, because I try to get those out as well. So thank you for that. If I just one little thing, going forward, we're going to start focusing on a little bit more on because I was supposed to have the behavioral health work group for CPC give an introduction of the work that they're doing, and to so that you guys could know what's going on. I say behind the scenes, but I mean, that you don't probably get to hear much about, and because they're doing a lot of work with the crisis intervention and behavioral health, and we'll have the crisis intervention team come and give a presentation as well soon. If there are any topics, I'm asking you, because I'm getting ready to start the planning for the next year, any topics that you want a presentation on or want to bring to the group, please don't hesitate to contact me. And with that being said, thank you guys for all being here. Thank you for hanging in here with me in my computer ailments. And thank you.
Well, Felicia.
Hi, Marta.
Thank you,
Felicia.
Lisa.
Hi, everybody. I know I missed most of it, but I tried to
Hi,
join in when I
Shalini.
could.
Thank you.
Felicia,
Thank you. Bye-bye.
I
Good night.
appreciate
Thanks,
you.
everybody.
Can we
Yes.
do a redo of this
Oh,
topic
good
here?
seeing you,
I don't
Felicia.
think we got finished with this topic. So
Yeah, we got started late, and yes, we can. And like I said, I'm going to have Dr. Halfott come herself.
let's
And
make that the next one up, because we need to keep moving and see some change when we come and spend our time helping you.
absolutely.
We need to see that there's something being done and addressed about.
Well, you see, that's the reason why we brought it up, because a lot of people, there was a lot of conversation that I'm pretty sure Alexander wasn't quite geared for. But that's the reason why why I'm wanting to have these conversations. Okay, Geneva, I got your message. Cindy called me. Sanaa, good to see you.
I will call
Did
you.
I get
for sure.
everybody? Okay.
Thank you so much. Hey, Geneva Taylor.
Felicia, I love you. I sent you an email.
Okay.
Thank you for getting it.
I'll
talk to you guys later.
And Cindy, I need to talk to you. Thank you, Delane. All right. Jacob.
Yeah, thank you for the invitation.
I feel honored.
Noble representative.
Noble. Mr. Stern, you just know how much you're dear to my heart.
Do you want me to call you now or?
No, in a minute, in a little bit.
Okay.
Dr. Gill, I appreciate your endurance. And I want this to be good. I want this to be for everybody. I want these conversations to not be venom. I want us to all learn from all the issues out there, because we don't all see through the same eyes. So I appreciate the engagement. Respectful engagement, I appreciate. Alexander, you cannot talk to Jackie because she already knew you. She already knew she was setting you up. Thank you for being here. Sinead, how are you?
I'm doing good. How are you?
I'm good. I'm good.
Have a good night.
Okay, you guys. I'll talk to you soon.
All right. Take care.
I've been on this computer since 8 o'clock this morning. Good night.
Good night.